Yeah, so that always throws me off every time. Um, so just to talk a little bit about psychosis and some effective substance use interventions, one thing I would say is the research suggests kind of substance use interventions that are effective for people with psychosis are pretty similar to substance use interventions that are um, helpful for other people. There might be some adjustments that are made in terms of sort of uh, timing expectations. There may be more rapport building and therapeutic relationship building with a person with psychosis than someone who doesn't have psychosis. And secondly, there may be some differences sometimes with information processing, how you deliver information and things like that. And certainly research suggests treating both conditions simultaneously would be optimal for people who would prefer that. But just one thing to say, pretty much the interventions are pretty similar. Also, what I'm really going to focus on is more of that kind of ambivalence, pre-contemplation, contemplation, preparation. And specifically, why is that typically on coordinated specialty care teams, your role in this is either sort of helping the person that you're working with as a team maybe coming up with their own sort of coping strategies to address their substance use or substance misuse, or maybe relying on kind of the natural supports of the community or your team, right? Or your role might be motivating them to kind of get a level of care assessment, which then that provider is going to determine based on your community, kind of what are the options they would benefit from. So for those reasons, I'm going to focus more on kind of those earlier steps. And the way I'm going to look at it, we're going to talk about it, is really based on confidence and importance. And if you look at like the research on why do people in general, what are some of the reasons why people are ambivalent about substance use treatment, but all kinds of other issues? There are oftentimes what comes up in different kind of ways of looking at it is the person doesn't have perhaps confidence that they're able to successfully make an improvement in that way. They may not have confidence that the system can support them to reach that goal, or they might not think that that goal is important, right? And there's a variety of different things that can affect that. But we're going to kind of look at those dimensions and look at some specific things that we might be able to do to target that. So yeah, motivational interviewing is a part of that a part of this package. And just to kind of speak to it, evidence-based, brief, applicable across a wide range of problem areas, everything from flossing your teeth to exercising while taking antipsychotics. Literally, it's been shown to be effective across a broad range of health behaviors and a broad range of helpers, which is why I think for coordinated specialty care, it's a really nice intervention too, because everybody on your team can do MI. There's not a sort of a scope of practice issue. And the definition I like better is having conversations so people talk themselves into change. And I'm just going to really highlight my team, who they actually do this work currently, but kind of some examples of that as I heard in a meeting recently where our employment specialist, Teresa, was really working on helping someone to find a school where they could not only get the accommodations they needed, but also where they could play football. Because what they all understood is that this person might not be motivated to pursue academic pursuits if there's not this component of playing football as well, right? So that was perceived to be equally important, right? Because it was equally important to him. And another example, which I love, is just our psychiatrist, Dr. McNamara, who's been meeting with someone who didn't want to take medications yet, but was really interested in brain science and wanted to meet with her and learn about the brain. So that was what she agreed to do with him and met with him. And that's what they've been doing, because again, that's what he was motivated to do. And we could all understand how both of those interventions could lead someone to ultimately realize their recovery goals, because the team is meeting those people where they want to be met. So it's just so important to know why someone what they want out of their life, and what treatment may or may not have to do with that, right? And these are kind of the four elements of motivational interviewing, but also if you kind of look at interventions or ways of being with people that have been shown to be effective for people with psychosis and substance use disorders, these constructs are going to come up over and over again. Partnership, collaboration. generally people like to feel like they're a part of the process, right? That you're the provider, you have your expertise. They're the person with lived experience of their situation. They have experience and expertise over that. You two are meeting together. And one thing that like I kind of highlight is a really overt way of being collaborative in this space is, so if I was going to educate someone about, let's say, how alcohol use affects their antidepressant, right? So I might say to someone, would it be okay if I share with you how your alcohol use might be affecting your antidepressant? I ask permission of that person first, because maybe they don't want to hear from me how alcohol use affects their antidepressant, and they have the right not to hear that, right? So they say yes or they say no. If they say yes, then I would educate them that there's some reason to believe that regular alcohol use could diminish the effectiveness of an antidepressant, right? And then so give them that information, and then I would wonder, what do you think about that? What do you think about what I just said? In this, when you're doing partnership collaboration in this way of providing education, you're generally asking permission to educate, educating, then wondering what the person thinks about it. It's a really overt way of being collaborative with someone. And again, if someone says, no, I don't want you to educate me, that's their right as a patient not to be educated. And you could document patient refused to understand how alcohol affected, antidepressant use. And if you believe you absolutely have to say something, then just don't ask permission, educate them, and then wonder what they think about it. But I would say it is important to wonder what people think when we give them information, because oftentimes it may not quite sit with them in the way that we thought it might. So partnership collaboration, very important. Empathy, as best you can, understanding where the person's coming from, what they're about, kind of what they want out of their life. Absolute worth, that's just that kind of cognitive work we all have to do sometimes as providers, where we have to see the beauty, the potential, the good in all people, and understanding sometimes behaviors that might be frustrating or probably that person's best attempt at surviving and probably worked for them in the past, right? Autonomy support is just consistently reminding ourselves and the person that we're working with that they have the right to decide what happens from here, unless they're, in a particular circumstance where they where they're mandated in some sort of a way that they don't have autonomy. In almost every instance we're working with people, they have the right to make decisions. There might be consequences associated with those decisions, but they have the right to make those decisions, and they have the right to experience those consequences as human beings. So saying things like, you get to decide whether or not you keep smoking weed or not, or you get to decide whether smoking weed in this group home is worth it for you if it may mean you get put out, right? Affirmations is essentially where you're really trying to make sure you're acknowledging, highlighting people's strengths, accomplishments, people's honesty. One thing I use as an example a lot is you may be working with someone who, let's say they said they wanted to have a little period of sobriety, or maybe they'd had a period of sobriety, and they come and they say, oh, Nick, I got to tell you, I went to my old friend's house last night and I picked up last weekend, right? Like you can get into a whole intervention around, okay, well, what do you think you learned from that? Blah, blah, blah. But, one thing you might want to say straight away is, wow, you're really honest. I give you so much credit for being so honest. It takes a lot of courage to do that, right? Because it does, and they didn't have to. And that's a healthy behavior to highlight, no matter what they're doing. Compassion, this is basically in this space is about being true to your ethical codes. These motivating interventions have sometimes been used in ways that weren't for the best benefit of the person that you're working with. As long as we're all good with our ethical codes and generally the standards of our organizations, we're good with that. And evocation is just trying to figure out ways to get the person to express their change. It could be artistically, it could be verbally, but it's things like, if our work together went really well over the next year, what will be different? I'd have my own place. I'd have a car. I'd have a job. I'd have a partner, right? Those are those things that then you can begin to wonder, okay, so you want to have a car. Like, what steps are you taking right now to get there? What can we do together to help you get to that point? So again, looking for those long-term goals and wondering what you could do as a treatment partner to help them realize those. When you're doing these kind of like motivational work, generally you want people to be talking or expressing themselves. Again, that could be artistically, collages. I used to do groups with people with more sort of negative symptoms of psychosis, and we did a lot of art groups, and they would do collages that would express their ambivalence and their change and what they wanted in their life. You could do it very similarly, right, with art as you could verbal expression. But basically, you want expression as best you can. Not everybody does that, and that's okay, right? Affirmations, again, we mentioned that. Reflective listening is this, which I'm going to give a couple examples of. It's just a long empathic statement to somebody. Summaries is even a longer empathic statement. And informing is what I showed a little bit earlier, where you're asking permission to educate, then you educate, and then you're kind of wondering what the person thinks about it. It's a specific way that you provide education or inform in the MI world. So developing a discrepancy. So an example of this is the person who, when I was working a young adult program for people with psychosis, it wasn't coordinated specialty care. It was some years ago at Frontline in Cleveland. Something would happen pretty regularly where we'd have these young adults who were wanting to get like machine operator factory jobs, because at that point in time, there were pretty good openings for people, even people who had felonies and things like that. But there was the dreaded THC test. And I don't know how many people I spoke to that felt like the test wasn't an issue. They had it beat. Don't worry about it. I got this. And then lo and behold, they about had the job. And then the THC, they actually were drug tested, came back positive. Whatever way they thought they were going to get around it didn't work. And now all of a sudden they want treatment. Makes every bit of sense in the world. That's when I want treatment too, is when things get hard, right? When my way of doing things doesn't work anymore, that's when I'm deciding I want to change. So developing discrepancy is oftentimes helping people pursue their goals and wondering how their drug use intersects with that. Because generally, over time, drug use does get in the way of people's goals. And people generally can ultimately see that, but it's kind of helping them see that over time. Rolling with resistance, if people are not ready to change, we can't make them want to change. And us trying to make them want to change, actually, the research shows this makes it less likely they're going to change. So really, we have to double down on just being empathic that this person does not want to change at this point in time. Boosting self-efficacy and expressing empathy. I'll give you some examples of all these right here at the end. So what do you do when someone has low importance, low confidence? Basically, they're saying, I don't want to stop using methamphetamine. I like it, and I couldn't stop even if I wanted to, right? This is like your pre-contemplation kind of a person. It's a therapeutic alliance, right? You're just trying to form a relationship with this person, continuing to get a sense of strengths, needs, as best you can, meeting their basic needs. Psychoeducation through that provide illicit method. Again, that's that asking permission to educate, then wondering what they think about it. And just a reminder that you can empathize with someone and not agree with them. So I could say, okay, I get it. From your perspective, methamphetamine works. There's no reason to change. I can say that and be honest in a way of reflecting that that's what that person's saying, but not saying that I agree with that. And sometimes you do these reflections. So this is about medication. I'm not taking medications. Those things make you worse, right? So you could do an amplify. From your perspective, medications are harmful. An amplified is it's giving kind of equal energy to what that person's giving back. It's kind of that intense energy. Coming alongside is a little softer reflection. You see mostly drawbacks to taking medications. Emphasizing personal choice, that's that autonomy stuff. You want to choose a different way to feel healthier, right? So generally speaking, these are kind of the interventions for that you would be doing for the person who's saying they don't want to change and they don't think they could anyways. So what about the person who's high confident but low importance? I could stop edibles whenever I want to, but I want to play games for now and relax, right? Who doesn't, by the way? Just kidding. But so developing discrepancy between a patient's current behaviors and their stated values and goals. So like maybe that is a meaningful life for them, maybe not, but I'd be wondering, like, what do you want your life to look like? And I might wonder, over the next couple of months, does like smoking or eating weed and however you say that as edibles and video games, is that kind of going to get you where you want to go? Or is there other things you might want to do to have a, the kind of life you want? Finances. I haven't met many people who felt like edibles help their finances. Usually drug use of any kind hurts your finances. So that's oftentimes a good way to develop discrepancy. Housing goals and current lifestyle, right? Similarly, drug use and housing sometimes are incompatible, not always, but sometimes. So, saying things like, I know that you'd like to save money for some new games. What are some first steps? I might not even bring in the edibles because I know in my head, we're going to have to get around those edibles if this person's spending money on them, right? But kind of letting them come to that realization. High confidence, low importance, just another example. Smoking crack makes me feel strong and I like that, but I could stop whenever. You would miss that strong feeling. That's just a nice, like that's what the person's saying. They like that feeling, they'd miss it. You're feeling confident, you feel really confident about making changes. 0 to 10, how important is it for you to stop smoking crack? How come you were a 1 and not a 0? When you're doing these ruler questions, you typically ask the person how come they're not a lower number, because that kind of evokes a little bit of change talk. So even if they give you a 1, how come you're not a 0? Or if they're a 0, then you can do a nice reflection. Okay, this is not at all on your radar. This is the lowest of priorities or something like that. So what about low confidence, high importance? So I really need to stop using meth because I got drug testing with my PO, but I've never been able to stop. So this person's telling you something different, right? They know it's important. They just don't have confidence. And I think it's really helpful to think about your clients from this perspective. Are they stuck on importance? Are they stuck on confidence? Is it both? Or is it something different? But the interventions are different based on where they're stuck. Generally in MI, you're doing reflections. You value your freedom so much, you're willing to find a way. Open questions. Tell me about another time in your life you overcame something that seemed impossible. You're trying to kind of get the person to inspire themselves through their past actions. There's some other specific interventions around boosting self-efficacy. Part of why you're doing affirmations in this motivational work is to kind of gradually over time help build people's confidence by acknowledging things like, wow, that was really honest. It takes courage to say that. Highlighting past successes. People, probably most of the people you've worked with have had some periods of sobriety, maybe even a couple of days. A couple of days is awesome. That's a lot to build on. And I would affirm that, dang, you got a couple of days, or you got a couple of hours, or you got how did you do that? What'd you learn about yourself doing that? Because a lot of times they'll dismiss that, but that's a big deal. Setting small goals and celebrating successes. When it comes to drug treatment, a good small goal might even be just looking at options, right? Like looking at kind of what are drug treatment options, what happens in drug treatment. That could be a first step, just exploring what in the world is drug treatment, right? um, encouraging role models, wondering if there's people they identify with, that they relate to, that they've seen make changes related to substance use. Are there things that they could do similar to that person? Role modeling is a really important thing. Sometimes in our field, we get really hung up on relapses because they can be kind of painful and upsetting. At the end of the day, they're a learning experience, right? It just means that at that moment in time, that plan didn't work. And what do we learn from that? Um, and lastly, when the person's kind of telling you, okay, Nick, I'm ready, like, boy, you did your thing. I'm ready to think about this drug treatment. I'm ready to do that assessment, or whatever. You might still want to help the person continue to talk themselves into that change a little bit, because all of us have signed up for things and then not gone. It's really easy to say, I'm going to do something. Doing it is a little bit harder, we all know. And again, the theory is the more people express change, the more likely they are to change. There's tons of research to support that. So, okay, wow, great idea. How come you're deciding right now is the moment? How come right now you want to learn more about fentanyl test kits? How come right now you're interested in that assessment? Affirming, that's a great idea. You used that to stop smoking cigarettes less in the past. Awesome. Reflecting, keeping your apartment so important, you're willing to look at smart recovery website. So basically just kind of doubling down on that narrative of change, right? And lastly, this is, basically good planning suggests, and this was borrowed from the business world actually, that people seem to be more likely to do goals or make changes when they operationalize them in a SMART goal. So specific, So, this person, because sometimes trauma, people with psychosis, sometimes trauma can affect substance use, and sometimes they might want to address that first or simultaneously. Complete one trauma exposure therapy assignment, right? It's very specific. Measurable. You could measure that. There's one worksheet. You would know it happened. The client you're working with would know it would happen. Achievable. The person believes that could happen. So, in this context, I would say, okay, well, we're talking about doing these trauma exposure therapies. Kind of what are you thinking is possible over the next week, right? From my perspective, 1 to 3 would be good. What makes sense for you, right? Person says 1, I think I could do 1. So now you've kind of agreed on that. Relevant, this person believes that doing this exposure therapy is really integral to their functioning and to having better relationships, and that's ultimately what they want, is better relationships. So you're kind of keeping focused on that, eye on the prize. In time, they're going to be doing that in the next 7 days. And these are some resources, references, I should say, references. There's also, I'll stop sharing, and there's a couple of things that just quick things. I wasn't being specific about specific treatments, but I have found more and more reason to talk about smart recovery for this population. Certainly traditional Alcoholics Anonymous, Narcotics Anonymous too. But smart recovery, there's some, first of all, it's so cognitive behavioral based. It is kind of consistent with some of what we're doing with CBT for psychosis and some of the other programming. It also has remote options for people who like those remote options. And similarly, there's just a much more overt willingness to delve into co-occurring issues with co-occurring psychiatric issues and things like that. So I have found Smart Recovery to be a pretty nice community-free support for people who are just kind of exploring things. There's lots of resources on there too that people can do without interacting with anybody. So they can you can go everything from being a part of a group to just looking at worksheets online. And there's also a www.motivationalinterviewing.org is a really good resource to show like videos of people doing MI and things like that. So thank y'all, and I'll take any questions or however, Nick, however y'all want to push this thing along.
Perfect.